So thank you to all of our three panelists. So Katie has volunteered to be the microphone bearer, and I'm just as we get seated. I think this was a nice kind of shift towards what can we do, and I really like the fact that we have very practical but deep interventions that were illustrated to us today. So it's sort of nice to think about some of the theoretical stuff that Dr. Lamb talked about, some of the experiences that we heard both personally from General Dallaire and also from vicariously through Anthony with his journalists as well. So it's really interesting to kind of change a little bit and see, where we might go and what we might do. So the floor is open to questions, and I think one of our panelists I'm not going to single anybody out, may need to slip away a little bit early. So if they do, the rest of the panelists will remain and answer their area as well. So don't feel under any pressure. So please go ahead. I think Master Siegel.
Thanks, Katie. So my question is about the relationship between digital obsession and neural health. If you think about what we've heard this afternoon, the notion of a break from the digital obsession, whether it's for physical exercise or whether it's for kind of letting yourself engage more fully with your own bodily and other experiences, and the notion of trying to get a break from the actual digital premise, seems to be salutary. That would imply that continued exposure to digital engagement is bad for your health. I'm interested if there's any data sets that would contribute to a better understanding of that. And if we have decided that cigarettes and alcohol and maybe even snuff is bad for your health, and we decide therefore to set some parameters around their use or where they might be used, are we heading perhaps at some point for some reflection on whether or not total digital exposure 24/7 is itself negative, not only for graduate students, but for maybe the human race? And are we heading towards some kind of consideration of what might be not a regulatory, but a prophylactic premise about how we might better engage with the digital universe?
So who would like to take that one?
Well, let's say it did take a long time for there to be some federal regulations about smoking. And I think they're working on federal regulations around alcohol intake and perhaps marijuana. But there hasn't been, that I could find, a lot of research done around sort of disconnecting and the importance of that, except that I did find an article, now I don't even have the citation for it, that talked about the distraction dilemma. And the biggest impact with the ongoing smartphone debate is that people tend to lose their focus, be easily distracted, and sort of not paying attention to what they're doing, which I think has really large implications around a number of things. We've seen the implementation of the don't drive and text laws, but I think that there should be others at later dates. I can talk to you from my own experience talking in front of large groups of students. They are often on their cell phones and not paying attention, and I mean, that's their right. Maybe they're really good at multitasking. I can tell you my kid isn't, so I'm not sure that's, it may not be generalizable, but I think there's an effect of being constantly tied into something, waiting for somebody to respond, that has some impact on people's attentional abilities.
There was another question. Go ahead, please.
There we go. Okay. This is a more practical question. I agree, and I think most people would agree that exercise and sleep and mindfulness and all these things are good for us. But what I think is maybe more a bigger challenge is how do you actually make that happen? Connect the gap between intellectual awareness that this is something good for me and actually carry that out. I was wondering what you guys thought about strategies or research areas related to that?
Ben?
It's kind of beyond. I think that it has to do with where your sense is politically about how much is individual responsibility. But I think there was a comment earlier in the morning about how systems of change have to start from the top. And you look at how Mayor Bloomberg in New York City tried to change beverage sizes against obesity. And I think that there's a dialectic, a tension about the fact that we know this has to be system-based, but there's also a lot of pushback in terms of things becoming policies. But I do think that certain things like, take the best example, which is alcohol availability. Great data coming out of CAMH, looking at the fact that the more liquor stores you have, the longer they're open, the more alcohol gets used. So these are policy-driven things that affect individual behaviors. And I think the same interface is probably true for exercise, nutritional content.
Great.
I think that there's also the experience of doing these activities and then seeing the results and falling in love with the process as well. And it's just like any hump. I think if you can begin, there are intrinsic motivators to that process, but you do have to start. I mean, I take your question to be, how do you take this from understanding it's good to knowing it's good in a more personal sense? But there's all this research now. I was thinking about interval training and exercise, and I don't know if you've been seeing, but there's been this ever decreasing amount of time if you do the right sequence of exercises to get some really robust results. I think they've got it down to 2 minutes now or something, which is hard to believe, but I think that fits with how little time we have. And, we're not going to set aside day-long meditation retreats very often. So 10 minutes is a lot more than zero. So I think that it's what we can fit in, but these things make a difference. And if we know that, I think we do tend to follow through more. I mean, it's kind of a simplistic answer, but I think. Yeah.
So just before the next question, just one comment, if I may make. I'm hearing that even a little bit of mindfulness helps, even a little bit of exercise helps. I'm afraid just a little bit of studying doesn't really help. So I hate to tell you that. I'm sorry. The next question, please.
Hi, I have a question here. Sorry. My name is Masha, and I'm a graduate student here at U of T. And my question is to the panel, but mostly probably to the dean and to Janine. And what interests me is how university and individual departments can play a role in making sure their students have a proper space and build resilience to become strong and not succumb to stresses that we have. And maybe you can be bold and don't really limit yourself to what we have right now, but in your ideal world, what would it be and what would it take, and what's the responsibility on the university and the departments?
Well, that's where the tension is, right? What's the university's responsibility? Because we're not a healthcare facility, and what's the individual's responsibility? And what's the faculty and staff who are involved with the students' responsibility? I can't sort of say lots about that. One of the recommendations is providing opportunities for students to develop resilience skills. We've been doing that through health and wellness for the last 5 years, and we'll continue to do so, and hopefully more broadly as we roll forward the mental health framework. But I think there's also an expectation that needs to happen with students, is that it's okay to ask for help. And I think that's another problem with students at University of Toronto, and I can say these things because I was a U of T grad. We don't think we need to ask for help until it's like really late. And then so much more needs to be put in place than something that could have been done much earlier in the experience. But I'll probably be in years' time be able to answer that much more effectively.
Thanks. So there was a question back there? I'm sorry. Maybe we can come to the panel after if you'd like to follow up. I want to give everybody a chance for one question. Whoever's got the microphone, I'm going to let you decide. Katie, you're in charge. That's okay.
Hi, I just wanted to ask a question with regards to what was said today in terms of mindfulness and exercise. A lot of students or people in general tend to try to cope with stress, not with mindfulness and not with exercise, but rather with addictions, such as smoking or alcohol or whatnot. And they kind of go too far into those recreational activities where it's kind of difficult for them to come back. Have we seen, or is there any research that speaks to the effects of mindfulness or exercise on um, on addictions, on reducing addictions?
On that. But intuitively, I think that mindfulness demands our attention, and it's hard to do when you're nursing a hangover. And I say that seriously because I think if you want to be doing that, there becomes a dissonance between the two ways of addressing stress, and there has to be a certain moment when it tips in favor of the mindfulness, I think. But they do compete a little bit, or they actually, you can't do both and notice. You'll notice the effects of the other. So I think that will happen for people if they take up something like exercise. Again, it has to be something that they start seeing the effects of. But yeah, I don't know if that answers your question.
So Ben, I mean, a lot of bipolar youth have addiction problems. Maybe you could jump in on that topic?
Yeah, I mean, I think that there's reward systems, and you saw the nucleus accumbens in the slide, and that are deficient in people that have depression or bipolar disorder. And so finding other ways of enjoyment, relaxation, may allow them to substitute that for exercise. There's also a lot of really good data that a lot of the different conditions that we have with different names, anxiety, substance use, depression, all have shared risk factors. And to the extent that you can have a well-governed life with regular sleep, regular exercise, good nutrition, that's preventative to all of these disorders. So it doesn't have to necessarily be, there are some things that should be really specific, but those healthy lifestyle behaviors, I think, offer benefits to all these teenagers. I will say really quickly that there's data from Dr. Faulkner's lab showing that if you're a smoker and you're trying to quit, and you just do a brief one interval of exercise, your withdrawal symptoms after a duration of not smoking are reduced. So I think there's some early data there.
Good. All right. Thank you for whoa, I'll just speak loudly again. Thank you. The question I wanted to ask about is you brought up the question or the aspect of multitasking, for example. I would perhaps counter that maybe it's not multitasking, but we're certainly more used to a more finely sliced experience of life around us. And it's interesting that you mentioned fine slices of exercise or fine slices of mindfulness. If you're talking about intervention, I was wondering whether you could comment on perhaps taking it from that approach.
I didn't follow the link. I'm sorry. Between the first part was about attention.
He was multitasking.
I was listening to his breathing.
Sorry. So it's not. I'm just curious because you're talking about sometimes it can be difficult to get people to follow through. For example, with exercise or follow through 5 days a week, for example, with one. Sorry, 5 times a week you mentioned. Might it be sort of relevant to go after this target from the point of view that it can be broken down into slices?
Yeah, and that's exactly what the research is trying to do, to give you the sense that it's not a lost cause if you can't exercise 5 days a week, but that even one shot is good. Studying it doesn't work for it, that's true, but for exercise, it can be beneficial.
So maybe what I'm going to suggest is maybe we will wrap up there. I think we've given Professor Goldblum enough time to prepare for his summary remarks. So I think I should probably hand this over to Professor Angel to take over from there. But first of all, I think our panelists really deserve a round of applause for a tremendous panel.